So another conversation that I had with one of our PTs down in Annapolis today was management and just differential diagnosis of proximal hamstring tendinopathy. And she had a good grasp on what was going on, what the plan of care and the interventions were, but we were just trying to figure out what are some ways that if we were unsure of proximal hamstring tendinopathy being the sole cause, what are some other things that could complicate either their presentation or their success with the interventions that we're performing? So things that come to mind with this for me are other muscles that can extend the hip, mainly being glutes. And then also we have to think about our neural tension and that sciatic nerve that runs through that area. A lot of your activities that are going to irritate a hamstring, so I think of like a toe touch or a straight leg raise, those are also things that can get exacerbated with neural tension. When we look at some of our strength testing, if we're not specific as to what and how we're testing that hamstring and being mindful of, is this a knee flexion dominant activity or a hip extension dominant activity, you may not be able to filter out some of the noise that you're getting from glutes and other muscles of that posterior hip area, either from an anatomical location, meaning they're just close to where that proximal hamstring insertion is, and it's tough to differentiate sensory impairments or just symptoms that they're feeling, or from a mechanical standpoint, if we're saying we're testing the hamstring, are we truly isolating the hamstring with our testing? So I think in our scenario, it comes down to being very intentional if we're doing any manual muscle testing. How are we positioning them? Where are we putting pressure at? If we're doing some sort of handheld dynamometry or we're using our Tindex system where we can get some isometric tests, are we putting them in a position, either supine or prone or seated, with respect to this being a two-joint muscle? Are we putting the hamstring in a position where we can contract it and make sure that we're not getting any extra noise from some of these surrounding muscles as well? So we talked about variations of testing hamstring at various lengths with regards to knee positioning and hip positioning, and making sure that we're getting the most accurate information to interpret from those testing results. And then you can also just look at your functional strength testing. And we're looking at how much are we putting into bilateral versus unilateral testing, and how much of unilateral testing are they going to have to work from a frontal and transverse plane standpoint to actually be able to demonstrate that hamstring strength that we're hoping to get that maximal effort with. So making sure with our testing, we're being intentional, we're being mindful of how maybe the stance or the environment or the position they're in can skew the results that we're getting, and looking at this from a holistic view. Last part that we touched on was from our mobility. They're doing a lot of hamstring stretches. We've talked about ways that you can tease out neural tension from a true hamstring stretch. I think that third piece of the puzzle is making sure that we're giving them some degree of hip mobility with regards to hip rotation and hip flexion, and really cleaning up that knee to chest motion, so that way we can also tease in and out how much deficit or how much symptom profile are we getting with our hamstring tests that may just be influenced by some hip immobility or lack of flexibility that we have. So proximal hamstring tendinopathy, always a tricky one because you have a lot of different things that can influence not only the initial presentation, but the ongoing progress and plan of care with that individual. But I think, as with all cases, if you just step back, look at it from an aerial view, get a good idea of what your buckets of need, your areas of interest are, then you can zoom in and you can look a little bit more on the micro level and start to turn the dials and fine tune exactly what you want and what's going to be the best fit for that individual.